Hello wonderful people, welcome to my channel. Today's discussion will be the continuation of asthma. So if you've not watched that of part 1, you can pause the video here and start from there. Let's continue. Asthma can be classified into two. First, it can be the allergic or the immune or the extrinsic asthma. Or second, it can be the non-allergic or the non-immune or the intrinsic asthma. We will first of all talk about the allergic asthma or the immune asthma. About the immune asthma, as the name implies, it is caused by your immunity, which as a result of your immunoglobulin E being increased in its level, and it will cause, in terms of any threat or any trigger, it will then show up, or when it perceives anything which is irritant according to the immunoglobulin E, then it will act against it. Talking about immunoglobulin E is, let's say, antibody or a protector which is within your blood, and what it does is the moment it sees any foreign material or any antigens, or let me say anything which is a threat to your body, it will show up to fight against. And when it shows up, it will cause those inflammation, which will cause your bronchi to swell or inflamed more, and at the end it will be causing production of mucus, which will all come together to form the obstruction, and at the end it will not be easy for you to inhale oxygen or exhale carbon dioxide. That's the reason. It's commonly seen among majority of the childhood asthma, and people having history of asthma, like those having the allergic rhinitis and atopic dermatitis. Let's talk about non-allergic asthma or non-immune asthma. In terms of non-allergic asthma, it is associated with numerous stimuli. It can be that stress which causes it, or it can be that strong emotions like fear, anger, or too excited, which will be as a result of causing of non-allergic. It can even be polluted air, when you inhale polluted air, or cigarettes, or smokes, or dust, or exposure to any occupational hazard, medications, all can be as a result of non-immune or non-allergic asthma attack. Or so in a nutshell, as an asthmatic patient, you should know yourself more than anybody. Your triggers can come from anywhere. It can be indoors, it can be outdoors, it can be the food you eat. For instance, indoors, maybe dust mites or drops of cockroach and mouse. The moment you see their droppings, you can't stand. It can be that there is pets, a certain pet like maybe cat or dog. When you see the fur or their feathers, you can't stand. Or smoke in the house, there can be smoke or air pollutions. You have to know them. Outside, there can be cold weather. You have to know that is what causes my trigger, so I have to exempt myself from such. So know yourself. What the kind of food can be shellfish, it can be peanuts, it can be egg, it can be many as you know them. So you have to educate yourself, know yourself well, to abstain from any trigger. About prevention of asthma, for those non-asthmatic patients or those who do not have asthma, if you really understood our discussion, you will know that asthma is not meant for any special group of people only, but anybody can be asthmatic. If you do not prevent yourself from air pollutions, occupational hazard, if you get exposed to them, or you get attacked to any respiratory infection which you couldn't treat it well, or even you treated it well but it was so severe, then you can be asthmatic, because it can cause narrowing of your bronchus, and at the end there can be obstruction which will not help breathing in and breathing out. So take note and prevent yourself from all that. And those asthmatic patients, you have to get well educated by meeting your doctors, talking about your condition. They will help you out. They will train you how to even rescue yourself from coming to contact with any of your triggers. They will give you medication, those short-acting medications, and even they will let you know most, even if it is not all, most of your triggers, in order to exempt yourself from going near or meeting them, in order to cause attacks or episodes of your asthma. And those using the nebulizers too, I think the use of that puffer and spacer is very good in terms of pushing the air, because that puffer and spacer is very comfortable and it helps the air to, or oxygen to, reach where we want it to. And the nebulizer most gets wasted in your mouth, so take notes and change them. Thanks for watching. Like, comment, share, subscribe, and suggest any of medical conditions you would like us to talk about, please.